Aloha kakahia kakako, aloha. Mahalo and welcome mahalo for joining us and welcome to Hawaii Care Choices Healthcare Talk Story. Happy beautiful Aloha Thursday. My name is Tish Lopez. I'll be your moderator this morning. And with me today is my co-host, Lani Weigert. Aloha, Lani. Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. We are also on Facebook, Instagram, and Twitter. Please follow us to see a lot of content, upcoming events, get to know our team, and supportive community members. If you are following us, send Lani and I a comment, a heart, or a shaka, and we would love to connect with you. We are, or for those of you that is joining on Zoom, the bottom of your screen should look like this. Please follow the green arrow and click on the chat box to say aloha and let us know where you are joining in from. We are so excited to launch the Empower Your Choice Talk Story series today, and we'll be discussing and exploring the understanding of health inequity and how it impacts your access to quality care. So anytime during this webinar, you may ask questions to our panelists simply by following that purple arrow, clicking on the Q&A box at any time. And to those of you watching on Facebook Live, thank you for joining us and aloha. Please use your comment box to say aloha and let us know where you are joining in from. Feel free to chat in questions as well as share your reactions with us during this talk story. We love to see the hearts, the thumbs up, even the care button. Also, feel free to share this live video with your friends. We are also doing polls today. So for those of you on Facebook Live, you'll not see the polls pop up, but we do want to hear from you using that comment box. So polling is very simple. And for those of you who've been with us for a while, it's also quite fun. A question will pop up on your screen similar to what you see here. Click the answer you think is best, and then click the submit button below. So just to get things kicked off, I'm going to launch an icebreaker now. So up on your screen is a question. What is your favorite movie genre? Do you like to watch comedy, action, suspense, romance, science fiction, even horror? Go ahead and click on the answer and submit. Just get that coffee flowing that we all had this morning, or maybe tea or water, and submit your answers. I see that they are all coming in. Wonderful. I'm going to end the poll right here and share our results. So 18% of you liked comedy, 27% of you like action or suspense, another 27 liked the romance, 9% like science fiction, and 18% liked horror films. Oh my goodness, that is so great. Thank you so much for joining in on our icebreaker. And it is just that simple. All right, so we want to move on and officially, oh, I apologize, my slides are not moving in the direction that I would like, but we have two incredible guest speakers today. And Justin Lamb, who is the current supervisor for the Office of Healthcare Assurance, or OHCA, the state licensing section. He has been the nurse supervisor since January 2018. Prior to that, Justin was a nurse consultant with OHCA for 3 years. OHCA is responsible for the licensing and regulation of every healthcare facility in the state of Hawaii, from hospitals to care homes. So today, Justin will address the inequity with available residential care homes in medically underserved communities like those across East Hawaii, leaving our elderly population vulnerable to negative health outcomes. And we definitely want to welcome him. Our second guest speaker is Omar Bird, Coordinator and Director of the Office of Health Equity for the Hawaii State Department of Health. He will give us an overview of inequality, equality, and equity. What's the difference and how does it impact you? Omar has been living in Hawaii for the past 10 years, where he is finishing up his doctoral degree in medical sociology. His specialty is centered in health over the life course, so inequality in institutions and cultural studies. Omar has been invested with several grassroots movements in Hawaii and shares his knowledge and passion for discussing social issues and activism through podcasting and political organizing. Welcome, Omar. Welcome, Justin. We are so glad to have you folks on today. So without further ado, I would like to give a virtual warm round of applause to Justin Lamb.
Yay.
Hi, aloha. Thank you so much for joining. So while Justin's getting ready, his slides ready, I just want to let everyone know that we have entered the summer season here on Talk Story with a focus on community well-being and safety. But today, like I mentioned, we begin our journey with Empower Your Choice, understanding health inequity and how it impacts your access to quality care. So this is the first of many episodes, and I can't wait for this one. So aloha, Justin. Thank you so much for joining us.
Aloha, and thank you for the warm introduction. It's great to be here this morning. So I'm going to go ahead and get started. I'm going to share my screen then. Okay, can everybody see okay?
Yes,
Great.
we could definitely see. Great. Thank you.
Great, thank you. So yeah, thanks again for having me. For those of you who don't know me, I'm Justin Lamb. I'm the section supervisor with the Department of Health, Office of Healthcare Assurance. Within the state, we like to use a lot of acronyms. So I'll be going over a few of those acronyms today. So moving forward, I'll be referring to us as OCA or OHCA. We are responsible for the facility licensing across the state. Any facility that's required to be licensed or certified is licensed or certified by our office. And I'm going to go into that a little bit. But how it affects you guys is there's many facility types in East Hawaii and in the rural communities across the state. And so this is kind of giving a breakdown of what OCA does and the different facilities that are available in you guys' locations. Okay, so what is OCA? We're under the Department of Health. The office actually has two separate sections. So I'm the supervisor for the state licensing section, and we license all those different facility types there. There's also the Medicare section, and the biggest difference you would need to know is that the Medicare section licenses the larger facilities that can bill for Medicare. So those are typically hospitals and health centers, skilled nursing facilities, and things of that nature. And those are typically larger institutional type facilities. In my section, we license and certified the more residential type versus institutional type facilities. So when you hear the term care home, typically you're looking at the first two on this list, which are the adult residential care homes and expanded adult residential care homes. Those facility types accept both private pay and other various types of insurance, including Medicaid. You typically, for type 1 ARCH, they're 5 or less residents, and these are care homes that could be in your community, that could be your neighbor, could be on your street. You wouldn't necessarily know that a care home is being operated there. It's supposed to be like a home-like environment, and that was the intent of the initial licensing program of those types of homes. You also have community care foster family homes. Those are, it's a Medicaid-based program with 2 or 3 residents in there. Adult daycare centers, that's exactly like it sounds. It's daycare, and the residents wouldn't be staying there overnight. We also license case management agencies, home care agencies. Assisted living facilities, those are facilities where it's more of a senior apartment living, where services would be provided to them, including some nursing services. And then your special treatment facilities and therapeutic living programs, they're more for like a step down from like drug detox, or it could be a mental health type of facility, or support for victims of abuse, that kind of thing. More or less, they just need some type of a positive living environment for a short term before they move back out into the community. And developmental disabilities, domiciliary homes are for individuals with developmental disabilities. And we also license dietitians. So a lot of facilities we license and a lot of acronyms. I know it's confusing, but just bear with me here. So our section is divided up in, or sorry, our office is divided into 2 sections, and this is kind of a breakdown as far as the different positions that we have. So we have, clerical services, supervisors, registered nurses, public health nutritionists. So we have a lot of different professionals on staff. So focusing on the Big Island, we have one assisted living facility on the Big Island currently. 111 community care foster family homes. So just a refresher, those are those smaller Medicaid-based facilities that have between 2 or 3 residents. We have 1 developmental disabilities domiciliary home, 8 skilled nursing facilities, but those are institutional type facilities, right? 6 special treatment facilities, 5 therapeutic living programs, and 36 adult residential care homes. So this slide doesn't necessarily paint a full picture. When you look at, we actually have 1,400 community care foster family homes across the state, and only 111 of them are on Big Island. So there's desperately a need for more community care foster family homes to open up, because there are people in the community who are on Medicaid who do need housing, right? Or who do need care and need housing. Also, with adult residential care homes being at only 36, we currently have around 450 across the whole state. So Big Island being such a large land mass and only having 36 homes or care homes is an issue. Another issue that we've been noticing in recent years is that the adult residential care homes on the Big Island, we can't license them as fast as they're closing. And there's a few issues with that, whether it be, the care home operators are just getting older and retiring, and the kids don't want to take over because they see what, mom or dad did for the last 30 years. And they're like, no, I don't want any part of that. Also too, we've been running into some care issues with some of the care homes over there. And unfortunately, we've had to close them down. But regardless of that, we haven't been able to replenish the number of care homes that have been closing, unfortunately. So that's one of our big issues that we're trying to address. So the need for care home licensing, it's not only required in statute or Hawaii revised statutes, which is state law, but care home licensing and facility licensing in general provides uniform standards for facility types and ensures compliance. And ultimately, the intent is to protect the public from illegal operations and from unsafe homes. So regulatory compliance is, in short, just to follow the law. And our office, we ensure regulatory compliance through the laws or the Hawaii revised statutes and the rules, Hawaii administrative rules. So it's not only to protect the public, but it's also to protect the caregivers too. There's caregiver rights in the administrative rules, and as well as residents' rights too. So it protects all the parties. So why is regulatory compliance important? Regulatory compliance, it helps us meet our goal to protect the health, welfare, and safety of the residents in the facilities that we license. So besides issuing licenses and doing inspections, what else does OCA do? So for my section, for the residential type facilities, the facilities get a dedicated nurse consultant, and that nurse consultant is the point of contact for our office. So they're the ones who typically will conduct the inspections and the visits of the facilities. But they're also available via email and phone. Our office also does a lot of teaching, like this, presentations and services. But we also, during the inspections and the visits, it should be kind of a teaching opportunity for the caregivers. We also do newsletters and other outreach like that. And our other mission is to also advise. So when the care homes are thinking about doing something like adding a room or sprinkling their house or something like that, or they want like a wheelchair resident or something like that, they can discuss with us first, which is always the best option. And then we can advise them on how to be compliant with the laws and guide them like that. And then we also do other outreach as well. So moving forward, the future of OCA, we're trying to embrace technology to increase efficiency. So we're using a Microsoft CRM database to basically expand data collection, and also it has our master calendar and all of our facility information as well as inspection information on there. So it's like a centralized hub, and we're looking at expanding that to also hold like documents as well, as far as like facilities, letters, and applications and things of that nature. And we're going to start utilizing more modern technology. So currently we're using email, but we're also looking at chat and text options. Also too, I have to update the Hawaii administrative rules. I have 10 sets of Hawaii administrative rules I'm currently updating. So pretty much the rest of my career will be doing that. And we're also cracking down on unlicensed care homes. It's a big issue, both on the Big Island as well as across the state. And we're coming up with new strategies and new legal action against those homes. We're also looking at shorting the facility application timeline. That's been a big issue, and it's been a big, one of the biggest barriers, especially on the Big Island, that, you know, potential applicants say, oh, you know, I can't wait an entire year to open this care home. I can't, like, you know, that's too long for me not making any money. So we're trying to do our best to shorten the timeline. So, and the timeline we're looking at, the metrics we're using is from when the facility or the house is actually approved by city or county to hold those residents, and then gets a building inspection. So for this calendar year, we're looking at 6 months, and so far we've been able to meet our goal for the most part. And then next year we're looking at 3 months, and then the year after that we're looking at 1 month. And, you know, utilizing technology, electronic applications and things of that nature, we're able to shorten this timeline significantly. And also we want to prioritize communities in need. If we see an application is coming in from a rural area, we will pretty much jump them to the front of the line, because ultimately the community needs more care homes in those locations. Quick story, we had an applicant on Molokai, and we used to have 2 adult residential care homes on Molokai, and then unfortunately they closed down. And so we had a potential applicant on Molokai reach out and say, hey, you know, I want to open one in a care home in my house. I said, oh, great. Okay, let's get this going. So, you know, we accepted her application, and actually we sent out inspectors to go look at the facility right away. And so even though we tried to expedite, unfortunately, there was a lot of renovations that were done to the property but without permits. And so unfortunately, the property wasn't safe for residents, so we couldn't license it. So that's another common problem in rural communities too, is they just think, oh, I'll just, you know, I'll make this awning and I'll add this extra room and I'll put it, you know, unfortunately, if it's not permitted, it's not legal, and we can't ensure the safety, unfortunately. So that's something to keep in mind when you're looking at opening a care home. Okay, so I'm going to open it up to any questions you guys might have now.
Thank you so much, Justin. Friends, if you want to put your questions in the Q&A box or in the chat box, either or, and I can definitely ask those to Justin. Lonnie, did you have any questions for Justin?
Sure. While people are putting their questions in the chat, I wanted to know, thanks so much, Justin, for sharing this all with us. You know, besides the fact that people have unpermitted renovations, what would you say are some of the bigger challenges with regard to opening an adult residential care home?
Definitely staffing. You know, a lot of people might be willing to be a caregiver and open a care home. It could be like a husband-wife situation, but ultimately that's really no way to live, right? Like, because it's a 24/7 type of operation. So you or your husband or wife would be at home all the time. And so getting substitute caregivers to be able to come in and that they're qualified and are, you know, can cover for you while you go, you know, grocery shopping or go on vacation or whatever. That's extremely challenging. You know, there's a healthcare staffing shortage across the state, across the country, right? So the care homes are definitely affected by this as well.
Thank you so much for that answer. So does that mean, like, say if a husband and wife decide to do that, do they have to be certified in some way? Like, do they have to have a certified home health aide type of certification, or say they bring their niece in who's going to help them? Because so if they go to the store, somebody's there to watch the people. does everybody that is involved in the residential care home have to be certified in some way?
Oh, it's an excellent question. No, so only the minimum requirement is that the primary caregiver or the main caregiver is at least a nurse aide.
Okay,
Everybody else who works as a substitute caregiver just needs to be over the age of 18 and needs to be capable of providing care to residents with various clearances like tuberculosis and physical exams, stuff like that.
okay, all right, okay, that sounds great. And before we start bringing in some of the questions from the chat, what would you say on the adult residential care home, the average stay is for a resident?
The average stay for a resident, typically it's more long-term.
Yeah.
For the most part, if the home is a good fit for that resident, they'll stay for years. I've seen cases where residents have stayed for 15, 20 years. We have homes that opened up in the 80s where the residents are the same residents throughout, which is pretty wild. But yeah, unfortunately, sometimes there is some movement initially when a person first gets admitted to a care home because it may not be a good fit. And it's not necessarily the environment, but it could just be that the caregiver and the resident just don't really mesh, or resident to resident kind of thing. But yeah, it's typically more long term.
That makes a lot of sense. So if there's some maybe misfit with regard to that residential care home, how does the patient find another care home to go to? Do they go to the case management people that you mentioned?
So case managers can definitely help. However, typically the care home operator, the care home operator is actually required to assist with finding placement for the resident. It's in the administrative rules. But there's also placement agencies too that exist now. There's a few various ones that will assist families and residents in finding other placement.
Okay, that's great. Thank you so much. Tish, is there any questions coming forward?
There is one. In the rules, are there a staffing to patient ratio standard required for care homes?
Good question. Yes and no. So for adult residential care homes, they have to have, someone has to be there 24/7. There has to be a caregiver there. And then if you have what's called non-self-preserving residents, meaning residents that can't get out in the case of an emergency, there has to be at least one responsible adult on the premises for every non-self-preserving resident. So if you have 2 wheelchair residents, you would have to have at least 2 caregivers there at all times.
Okay, wonderful. Another question came in. Do you have to be a CNA to be the ARCH administrator, or can you have your NATP? Not quite sure what NATP is, sorry, but that was the question that came in.
That's a good question. So there may be a change in the administrative rules that does require the nurse aide to be a certified nurse aide. However, those rules have not been finalized yet, and we're not sure whether or not it'll pass. But basically, if you have nurse aide experience, you could apply as a primary caregiver.
Okay, wonderful. And is there dedicated nurse consultant counts per island, or let's see, nurse consultants per island, or traveling nurses throughout?
All the nurse consultants, for the most part, will travel. So the islands aren't dedicated to one. Like, we don't have a specific nurse consultant for Big Island, a specific nurse consultant for Kauai. Each nurse consultant will have a few homes on each island.
Okay, wonderful. That is all the questions that came through for now. Great questions, listeners. And thank you so much, Justin, for just sharing all of that amazing information with all of us.
You're very welcome. Thanks again for having me.
Thank you. So you're welcome to stay, or we completely appreciate the time you spent with us so far. Thank you again.
Thank you.
All right, friends, switching gears a little bit, we are going to bring up Omar to our virtual stage as he talks about the inequality, equity, and equality. What are those words mean? How are they different? How does it impact you? Aloha, Omar.
Hi there, and aloha, everyone. Really appreciate it. And Justin, really Awesome presentation. So I'm going to link a lot of the ideas from yours into mine because I had questions. I was like, I'll just wait on that. So yeah, thank you so much for the warm introduction. I'm really happy to be here. Yeah, so I'm just get my slides set up and we'll get rolling here.
Yeah, awesome. Thanks so much, Omar. Justin, since you are on with us and while Omar gets his slides, do you have any words of encouragement for those who are looking to open up a residential care home?
Yeah, just reach out to our office via email or phone, and then we'll try and work with you if you have any ideas or kinds of ideas you want to throw around or questions. We'll be happy to answer them. We also do a complimentary plan review. So if you're wondering whether or not your facility could even house residents, you can send us a half-size blueprint, and then we do up to 2 complimentary plan reviews per property. So yeah, feel free to send us your blueprints and requests.
That is so helpful that service is complimentary. So thank you for sharing that. All right, Omar, I see your slides. They are all clear. We
Great.
are ready to hear about this.
Awesome. So can everyone hear me?
Yes.
Okay, great. So as discussed, the conversation today is just a broad conversation around inequality, equality, and equity. So I do encourage questions because hopefully we can build on these conversations moving forward. So that's kind of how I set up this presentation. So we're going to just quickly go through the basics of what those things are, the Hawaii factor, meaning like how are some of these things being seen in Hawaii, then the so what, like why does any of this, what we're talking about today even matters, and then what can we do as individuals, what we can do in the workplace, and then just a small closing. Okay, so again, thank you for the introduction. Just a little bit about me was already said. I'm the program coordinator / director for the Office of Health Equity. I started on May 1st, so I'm pretty new, and a lot of our staff is pretty new. So the Office of Health Equity was established around somewhere in 2022, but we actually started being more fully staffed over the past year. So we do have a lot of like establishing things to do, such as putting like our mission and core values and those things on our website that's being internally developed, and we're reaching out to the community. So there's a lot of those types of things happening. And at the end, if anyone has any specific questions about the office, I can definitely share that, but that's not what we're talking about today. So I'm also a public social scientist, a podcaster, social movements organizer. I love basketball, quality time with people, learning, nature, video games. So I'm a real person, despite I'm wearing a state hat. And I'm really grateful and happy to be here with all of you. So let's get started. So I like to level set a lot and kind of get a read of the room. So as the poll is coming across here, what does equity mean to you? And I realized, and you'll see this theme throughout the presentation, that framing is massively important. And I even realized that even this question could be misleading. Like asking the question, what does equity mean to you, is different than what is it? So you can interpret that how you want. That's okay. I think the purpose of the answer here will be more revealing. So go ahead. We'll just leave a couple minutes, not a couple minutes, a couple seconds, minutes to get through the polling, and then we'll just move on forward.
Awesome. So friends, that question is up on your screen. I do see answers flowing in already. No right or wrong questions. We just want to hear your answers or what you think about it. For those of you on Facebook Live, you will not get to see the polls pop up, but we want to know, what does equity mean to you? Is it something in the area of addressing race, racism, or inclusion? Is it agenda for wokeness? Is it about bringing society together to share trauma? Is it maybe something else, or are you just not sure? Go ahead, put that answer in the comments. I am going to end the poll right here and share our results. So 67% said something in the area of addressing race, racism, and inclusion. 11% says it's about bringing society together to share trauma, and 22% said other. Well, thank you, friends, for engaging in our polls. Back to you, Omar.
Yes, thank you for sharing that. And as you can see, the first one was the one that was most heavily selected, which is something in the area of addressing race, racism, and inclusion. And I just want to say that though that's important, that's not the full scope, but we'll come back to that. But I just want to let everyone know that depending on who I ask and where I ask this question, the percentages vary. And as you can see, even in the polling here, those percentages vary. So we'll circle back to like the implication of that in just a moment as we go through this next component here. This is frozen. Okay, so here is like a visual description of what the difference between like equity and equality. And most of the time, people will zero in on the two middle rectangles where you see the equality and equity. But we're going to start from the box on the left and then move to the right. So on the left, we can kind of see like the playing field or the environment that we're in as like our society. And we can think of society loosely as, you know, whatever nation state that you belong into, or the workplace setting that you're in. Or if you're talking about college students, then their society would be the whole university environment. So that's like a microcosm, meaning like a smaller version or a simulated version of like the larger world. Or sometimes, depending on what you're talking about, you can talk about society as like the whole planet. So in reality, so our lived day-to-day lives is just full-blown capitalism as we know it. And you think about the haves and the have-nots, the 99% and the 1%. So you can see the person stacked on the left with growing accumulation and wealth, you know, the middle class in the middle, and then people who are either marginalized or underrepresented, or people who can't get ahead, you know, all these different types of things. This is full-blown capitalism on the left as we see it since, you know, since the beginning of the United States and beginning of a lot of these nation states. But so to move from that, we're talking about equality, and we're very familiar with this term. And equality rhetoric and equality discourse and equality-based policies usually are the principle of treating everyone the same, providing opportunities and resources regardless of one's social status. This all makes sense and sounds okay, but this uniformity focuses on equal treatment without considering the specific needs of specific people in specific places. So in a lot of ways, like this could be well-meaning and well-intended. Like everyone's just treating the same. Don't worry about everyone. Like we're all here together. Everyone should just get the same thing. But again, going back to reality, not everyone is situated in the same spot. So thinking that we can just give everyone like the same plot of money or the same type of resource will have the same effect. And I think Justin alluded to that perfectly when he was describing how they can try to change some of the systems, and when there's a long line of need, they will prioritize people who are in more rural communities up to the line. So that's a more equity-based approach, because you're actually prioritizing people in their specific needs, but not just only focusing the most vulnerable. We're trying to do a lot of different things. So thinking about equity, the third rectangle, refers to fairness, transparency, and justice in the distribution of resources. Because then that means before you go ahead and launch any of your activities, any of your programs, any of your initiatives, you're taking the step to engage with the community, doing some more research to figure out what are the specific needs in these specific locations. Because again, as Justin said a moment ago, there's a physician shortage, there's a nurse shortage, there's a facility shortage all over the country, and they're closing rapidly for various reasons. So that's a standard problem in the United States. But if you wanted to think about that issue specific to Hawaii and how that's different across even the islands, again, as Justin alluded to, there are, let me write this down, there are what, 1,400 state community facilities, but only 111 on the Big Island. That's a huge disparity. So again, we're trying to move to the equity component, because that is actually taking people where they're at while making sure that we're also paying attention to everyone involved. And while we're trying to get through equity, we hope to get to liberation, which is now we're in a situation where there are no barriers to access, there are no barriers to certain types of quality of care. We can actually live free from these types of constraints. Now, when I say free, I don't mean everyone can be the person on the far left with all the boxes and all the money. I just mean free and have the ability to be fully autonomous, fully self-determinate, without being like, oh, I don't have enough money to pay for food. I gotta make choices for childcare. Oh, can't think about renovating my house. Like all these compromises that people need to make simply because of the unfair, unequal distribution of resources in the world of our reality. So we want to use these frameworks to try to get us to legit liberation. So if that was too dense to kind of wrap your head around, this is another way of looking at it. You know, as the cartoon clearly states here, for a fair selection, everybody has to take the same exam, which makes sense, right? Which in like knee jerk, like intuitively speaking, you give everyone the same exam, you teach everyone the same things, and then ask them to execute. But clearly, like in doing that, there's no understanding of the people who you're asking to do the test. Some people can obviously do the tree more easily than than the elephant, all these different types of things. So it's the same type of an example. We think by sitting behind our desks, we come up with these policies, we think we're well-meaning, but there's something that's missed. And I think a lot of people in Hawaii kind of understand that. And I think that's what's really unique about Hawaii is that there's this, it's not just individual local people or individual local offices. There's a general sense in Hawaii that talk story and building community and building relationships is highly valued. But then now how do we coordinate our efforts to get our state agencies to actually make that bridge and sustain it? It's not just making it once and making a connection once. We have to sustain, and then not just sustain, but then grow and expand and strengthen these ties and know that we're going to make mistakes. So we have to then be willing to then go back, re-examine our tools to then continue to move forward. So thinking about like the difference between equity and equality and like a more real life example, and there's a link in this PowerPoint if you want more examples like this, but think of it this way. A food bank is often needs to make judgments based on equity versus equality. For example, they may choose to have a limit of 1 bag of groceries per visit, but they know that there are some mothers who come in with very large families who struggle to feed their whole family on the usual 1 bag policy. As a result, the food bank decides to make exceptions for these mothers so that their children don't go without. Perfect, makes sense. Here, they have prioritized every child getting access to adequate nutrition above an equality policy of 1 bag per visit. So in equality-based responses, food bank gives the amount of food to every family. First come, first serve. And when you run out, you run out. But an equity-based solution would be food bank gives more food to larger families or those with dietary restrictions. And then a step further, so the doing more part is something when you're thinking about it more deeply, for the long-term start to develop policies that expand that 1 bag rule. So now we can ask and think more questions about who can we get involved to bring to the table. And Justin, again, had a really good workaround in a policy when thinking about the future when it comes to shortening maybe the application process, so you can kind of get a head start on licensing facilities before they end up closing down. That could very well be a simple policy change that you need to aim at the system, as opposed to saying, people need to make better choices or those types of individual-based like anecdotes or solutions. So again, equity also focuses more on the system's responsibility to flex and change on people's needs, as opposed to saying the individual needs to be more vocal or the individual needs to make better choices. And then equity often means developing both short and long-term policies at the same time, because if you don't, you're just going to continue to make band-aid fixes. And in the long term, that doesn't actually give you sustainability. You'll just constantly have like a little bit of success and then a dip, a little bit of success and a dip. If you want to sustain and build and grow, we need to shift our mindset more towards equity. And I think the pandemic really like illuminated those types of components. So again, if you need more examples on that type of thing, there are 15 other examples in that link in this PowerPoint slide. Okay, so here's our next polling question. So does this sound like equity or equality? And it's supposed to sound a little, maybe sound a little confusing or tricky, because that's kind of the point for this quote I'm going to read to you. And I heard this from a local Hawaii resident when I was doing research on equity and just talking to people about what they think about it. So does this sound like A, equity, or B, equality, or C, unsure? We are all Americans here, right? Can we just agree to disagree? It is never helpful to see color, meaning like people's like racial or skin color. Everyone deserves respect, and we need to be tolerable and celebrate our differences. Think about it, right? This is Hawaii. We are one big melting pot of races and people. We all get along. Is that an equity-based framework, or is that more of an equality-based framework? And I will explain why this small distinction matters. If you're unsure, that's cool too.
All right, friends, so that poll question is up on your screen. No right or wrong question. For those of you on Facebook Live, you'll not be able to see the polls pop up, but we still want to hear from you. Go ahead and put that in the chat. I'm watching it on my other screen. And we just want to hear, does it sound like equity, equality, or maybe you're unsure? All right, I see more answers flowing in from our listeners on Zoom. All right, I'm going to go ahead and end the polling right there and sharing the results. So 13% of you said equity, 75% said equality, and 13% were unsure. So thank you so much for participating in our pollings, and we are about at 10:43.
Okay, I'm
going
to zoom through the rest. Okay, but I just want to focus here on this first. And for those who said this is an equality type framework, spot on. But I want to explain why seeing that distinction is important, and then the implications of that. So the key words in this phrase here is, where is it? We are all Americans here, right? And then that explains like the remaining of the quote. And this is what is called like an ideological trap. And what I mean by that is this: when someone expresses something, a disagreement with you or something like that, and then the response is, well, we are all Americans here, right? We are all we're all here trying to work together. So can we just disagree, or can we just move on? That completely flattens the relationship that are different among people, as if to say all Americans think the same, as if we all are invested in the same project of building the America as a nation state. Everyone has different processes or steps in that. Some people were brought here forcibly. Some people have escaped other places and looking to the United States as salvation. There are some people who want to break away from the United States. So there's so much. So to say, oh, I hear your concerns, but I disagree with them, but we're all Americans here, right? It's an assumption that we all are on the same like wavelength of ideas about this space. And then that totally allows us to ignore the problems or the solutions or the things that we are dealing with in our everyday lives. It actually discourages conversation. That phrase, to agree to disagree, actually discourages us from more learning. Just moving along here, my screen just froze. Okay, so then how does this then matter for health inequality? Well, let's see. So health inequalities are reflected in differences in length of life, quality of life, rates of disease, disability and death, severity of disease, and access to treatment. But then, so that's outcomes. But then what contributes to those differences? If life of life, quality of life are those things, then what's the process? What links those things to those different health outcomes? That's the social determinants of health. So who we are, what we do, where we live, how we live, work, and play, all of those things fundamentally contribute to health outcomes. And then of course, policies, access to insurance, all those different types of things. So here's just a general landscape of health disparities in Hawaii based on racial identification. So looking at this chart here, cancer death rate by race, ethnicity, Hawaiians and other Pacific Islanders far outstrip all the other racial ethnic categories here. And then as you see here on the left, it says people who identify in this category share a disproportionate burden of chronic conditions and health outcomes compared to other racial ethnic groups. So oftentimes the conversation will just stop there. And we'll just say Native Hawaiians and Pacific Islanders suffer the most, so we need to focus on that community. I am not saying that that is not important. Absolutely, it is important. But if you're looking at like the recommendations on a lot of policy reports, it's always like the most vulnerable, the most disadvantaged, the most. And then, so you can put a lot of policies and money there, but then what about everyone else? If the idea of chronic disease matters for everyone, we need to understand the rates for all conditions, but then while also paying specific attention, not all of our attention, but specific attention to what's happening in the Native Hawaiian Pacific Islander community, to ask, maybe for that community, it's a lack of access to proper screenings, and then for other communities, it's something else. And again, the why isn't because, oh, Native Hawaiians or these people in these poor communities just don't understand the system. That's often a stereotype. Maybe it's on us to provide more transparency on how these rules work. Maybe it's on us to understand people in rural communities who want to set up community centers like, hey, you need to have certain types of permits to construct your blah, 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 in order to get the licensing. Oh my gosh, I didn't even realize that. It could be something that simple. But until we go to the community to find out and ask, we will not know. We will just pull up graphs like this and go, oh, we've got to go to the most vulnerable. So again, here's another breakdown of this type of chart. But when you look at something like this, adults with diabetes and race and ethnicity, very different racial ethnic breakdown. So again, we have to think about all these specific things in specific cases in specific places. But we have another problem still. We need to disaggregate or zoom in even more into that information. Because if you look at this, and this was a project that was done in California, talking about COVID-19 mortality rates. If you looked at just the top three categories, that's the combined, condensed, normal, standard, federal kind of reporting of racial ethnic data. And if you look at all Asian, you see the rate. But then once you then break up the Asian category, oh, there's so much more nuance now. So we need to be doing these types of things. And this is just a lens into how to be more critical and forward thinking and how we investigate certain types of populations in certain areas to actually develop specific policies to deal with all of these types of issues. Now we can be more targeted in our approach and actually see more sustainability efforts moving forward. Same thing here. The top three, then you look at that category, all Native Hawaiian Pacific Islander. Once you break that apart, you can see so much more nuance with what's going on in certain communities, because now you can ask more creative questions about, okay, why is it that people who identify as Samoan have so much more of a disparity compared to Native Hawaiian? It could be a matter of counting. Maybe we didn't count enough, and this is distorted. Maybe there is something that's going on. Maybe we have more practices that lean on engaging the Native Hawaiian community and not enough on Tongan. I don't know. I really don't know. I'm saying like we need to be asking and thinking about these questions. But this is more than just about race ethnicity. And this goes back to the very first poll. It is, and this is, I cannot stress this enough. It is not a coincidence or an accident that the mainstream news, both on the left and the right, have smushed the meaning of equity and racism and wokeness together. So that now equity, the word equity, becomes a buzzword. And if we think about how that's been shoved into the public health domain in a very positive way, it was a direct response out of the pandemic and what happened to George Floyd. I'm not saying that that was a mistake. However, if we only think it's about racial ethnic identity, we forget all of these other dimensions that actually do contribute to people's health outcomes, like class and income, disability status, education. Again, Justin did a beautiful presentation on what it means for people in rural spaces versus people in urban spaces, people's last name and social status. And aside from all of those things, citizenship status is the single most powerful predictor of life expectancy, disease outcomes, far and above all of those things. People in the United States often have way better outcomes on a lot of these things. Like the poorest person in the United States often will have a lot better outcomes on a lot of these health indicators compared to many people around the world. So again, thinking about place and context is massively important in these types of discussions. So we need to really do the equity work. We need to pay attention to racial ethnic identity and pay attention to it closely. But we also need to move from ideas simply about race, meaning like how it makes me feel, and then killing the whole institution of racism as a system problem. Then we can actually pay more attention to all of these things, because it is racism that actually influences a lot of those other factors, because we're not talking about like the issues with capitalism. Remember reality, that first picture in that slide? Like, we're never asking those questions about like, how are we dealing with capitalism? Because that explains a lot of the other isms that we face: sexism, the patriarchy, racism, colonialism, those types of things. So as I close here, so what? Why does this all matter? We just talked about a lot of these things. I want to just focus on 3 and 4. These things are hard to think about. And before we can think about our ideas and our goals and our objectives to move forward, we need to have more education and more reading and more just undoing a lot of our normalized way of thinking. And that takes time and effort. But rather than thinking this is just a self-reflective process, I encourage you to think about just 2 things. One, the phrase like, you can't talk about religion and politics at the dinner table. Why? Like, why is that? Because those things fundamentally rip people apart within their own families. People can be ostracized. So, but everyone feels this and knows this, but we need to actually practice, because it's about language and communication. We actually need to practice thinking about this and sharing what we don't know and asking those hard questions. But don't just do this within yourself. Do this with people who you love and trust first, so you can be safe and maybe saying or asking questions that might sound offensive. But then read and actively read. Like, read, highlight, I didn't understand that. I need to go ask someone. Do your research, read, and then go ask and be active in your engagement. Pull these circles together. We need to create a collective consciousness around these things. And yes, we can walk and chew gum at the same time. So while we're doing this, like in the workspaces, we need to also be doing that, like creating small meetings with people who you can trust. Be like, hey, I'm learning this, I'm thinking about this, but what about you? That's when talk story becomes so beautiful, because then you can share your lived experiences. And then we need to scale that up, document this, go to people in community, ask 100 people. Don't just ask that one local Hawaiian and think that's supposed to represent all Hawaiianness. Ask people in Nanakuli, ask people in Hawaii Kai, ask people on another island, and then you'll see, oh yeah, Native Hawaiians think very broadly about a lot of things. Micronesians think very broadly about a lot of things, and it won't seem like it's a coincidence, there's a pattern, and then we can be more targeted in our approaches. So some remaining questions here that might help you generate just some thoughts, and that's kind of really it. I want to leave the rest for questions, and as it says here, like, what is hard or difficult when trying to have these conversations? And then this is my contact information. That's a link to the podcast. And yeah, you'll have this PowerPoint. And yeah, I'm here to welcome questions now that we have like 5-6 minutes left. Thank you.
Omar, thank you so much. I know, friends, it's our first episode, and we kind of joked behind the scenes, Lonnie, Omar, and I, this is really like Equity 101, because there's so much information, there's so much ideas and thought that gets put into this. But I did put in the chat Omar's question. What is hard or difficult when trying to have conversations about health, equity, or any related themes? So feel free to go ahead and put that in the chat. I'd like to, Lonnie, do you have your questions or comments about for Omar? Excuse me.
Of course, I'm so excited. Omar, thank you for just giving us the rundown on that. I mean, there's so much, it's a really big topic. And the reason that we felt it was important to bring equity forward so people can understand what the difference is that oftentimes we have services available to our community, but for whatever reason, they are not offered or have access to these programs. And we're really hoping if people start to understand that, hey, I actually deserve that, I can get that, I can ask for it. We really want to empower everyone's choice on what they actually deserve in the area of healthcare. So I love that you brought that out. So would you say that sometimes the barriers are self-inflicted, meaning based on our own bias and stereotype, that's why we're not able to like work through and get to the good stuff?
I see. That's a good question. I think it's both and. I think at the individual level, meaning like the actual person, I think a lot of times, I feel like a lot of times at the actual individual level, there's a lot of myths about how to engage with the system. And then there's a miseducation on how we think about our own health. I don't think that means it's the person's fault. We have been normalized and socialized in a space where you're not supposed to understand those things. So I do think it's on the individual's responsibility to communicate to one another, because that is something that we can do, and to understand like it's not just me that is dealing with this.
So you're absolutely right. You're absolutely right. We have a lot of community members that are operating under misinformation or the myth, kind of thing. So how do you feel, or can you give me some thoughts on how would be a good way to try to pull, break through that barrier? Because oftentimes people are operating with these myths in mind.
Mhm.
And what would be a good way to kind of, open up that conversation?
Sure. So in that slide, it said the greatest fears and greatest hopes exercise. So I'll just very quickly explain that. And this is hard. Okay, this is supposed to be hard. And I think admitting that immediately is the point. This is going to be hard. It's going to make you feel uncomfortable. And things like guilt, jealousy, anger, rage, anxiety are emotions that capitalism does not want you to embrace. So those are real, normal things. So first, we need to admit that this exercise is going to be hard and you're not going to have the answers. Write a controversial or sensitive topic to you at the top that you have strong, hard opinions about, or things you're a little unsure of, and write your ideas down. Like literally write this out. This cannot be something you do in conversation. You have to do it in writing or on the computer, because that forces you to actually step outside of your own thinking and go, what do I think about this? Because usually these conversations come up when you're faced with this bad news in the clinical encounter, or you see something on the news. So a lot of the times it's reactionary. Do this when it's a regular night at work, so a regular night at home. Write this down. Then write out all your thoughts and opinions, and then ask, why do I think this? Like, where does this thought come from? Where does this idea come from? And why? And if you write this out, then you can go, okay, actually, my mom just said this to me since I was 5, and I don't know if that's actually all that correct. Or, yeah, actually, I had a bad experience with a doctor. Maybe I need to rethink how I'm thinking about this. But then do this activity with someone else who you trust. So now you can then build more collective energy around what we don't know and identifying what we don't know, what we're uncomfortable with. And I think that will kind of like lower our individual anxieties to then move forward. But then there's a whole nother chapter on like how to then pull the people who actually hold positions of power closer to that level of understanding too. But I think at the individual level, that's something you can definitely do to start, for sure.
Thank you. Thank you so much, Omar. I'll pass it back to you, Tish.
Thanks, Lonnie. Omar, I think that was such a great, homework assignment for kind of all of us to do, right, in this Equity 101, is to really go and write down those ideas and those thoughts. And a lot of people in the comments were saying, the hard things is the word choice, thinking about how others feel, not wanting to offend anyone in any way. And writing those things down definitely helps so that you can kind of get your clarity of thought down, and then you can kind of change your words a little bit. But I think this is an amazing start to our Equity 101. Thank you so much. I want to go back. Thank you, Justin, for also being our guest on Talk Story today. It is 11 o'clock right on the dot. Omar, is there any words of encouragement or a little thought that you want to leave with our listeners today?
Precisely, yes. That part about the language and not offending anyone, stay there. Stay there. Because it is our language and our semantics and how we communicate is so important. And society, like the weapons of capitalism and the people who want to ensure that racism continues to work, want to make you think that it is actually really hard to have those conversations. It's only hard because it's uncomfortable. It's not hard because it can't be done. So, and it is the language that's hard to get right. So instead of trying so hard to get it right, ask. I need help. Or just say, I don't know how to not offend you in this conversation. How can I just be? It's much easier to admit your vulnerability. Sorry, it's if you want a solution, it's easier to admit your vulnerabilities in a safe space to move forward and then actually take more time to think about how, and then when you screw up, admit it. Like the other day I was in a conversation with people and I kept saying neighboring island, neighboring island, neighboring island. Oh no, sorry, outer island, outer island. And I'm just like, oh my God, I said this like 3 times. But I admitted my mistake and I moved on. But so sometimes you will slip up. If you get someone's pronouns incorrectly, just redo it. You know, we don't have to make a big deal out of the small things, and we need to actually pay more attention to the small things because they can lead to bigger change. So I want to have more conversations about this because there's so much that we can discuss, but think about the language because that's important.
And we'll definitely continue on with this Equity 101 and definitely talking about the health inequities that we definitely see. Thank you so much again. Friends, know that you guys are all invited to next month's Talk Story. It will be Tuesday, September 12th at 10 o'clock. Be on the lookout for that registration link, Instagram, Facebook. Also visit our website, hawaiicarechoices.org/healthcare talk story, or catch us on Facebook Live. Thank you again, and we will see you next month. Justin, Omar, mahalo. Have a beautiful day. Ahui ho malama pono. Until next time, take care. Aloha.